Wow, I am so disappointed at the amount of people that tell me, oh, my knees are just too old. I can't run anymore. Or my doctor told me I'm too old to play basketball. Or I can't run the hills anymore. I can't even walk my stairs. Today we're going to be talking about runner's knee. While this is a common injury among runners, you do not need to be a runner to have this condition. More importantly, knee pain does not have to disrupt your training. We're going to talk about patellofemoral syndrome and chondromalacia. First off, it's incredibly common. Most people try rolling, they try knee braces, they try taking a break from running, they replace their shoes, but none of these seem to really address the issue. The reason has a lot to do with the anatomy. But if you are someone who's feeling the pain, especially going downstairs, we're going to talk about the top 2 ways to figure it out and the best ways to fix it. Stay tuned. First thing we want to talk about is the anatomy, so you understand why this is happening. Sometimes the scariest part of pain is going to WebMD. That WebMD diagnosis is way worse than what's actually happening, even though the pain feels unbearable. So let's talk about the anatomy. As you can see here, the patella is this little circular bone that sits in the front of the knee. Most runners are really familiar with it. But the issue is, if it is not tracking well, meaning it's not sliding the way it should, it creates more irritation, more inflammation, and more pain over time. Think about it as you would with reps if you're lifting weights. You wouldn't want to do a ton of reps where the bone is grinding against another bone. Even a tiny bit of offset is enough to create a huge inflammation response. So we need these muscles around the knee to be working as a team. In the front of the leg, it's typically an issue inside of the quadricep, which creates a small strain or a pull on the kneecap. Sometimes you hear a clicking or a grinding, which is a good indication that this is runner's knee. Runners are machines. And running is what they want to do all of the time. So they don't typically do a great job cross-training. The first thing we need to do is mix up your training program. Most of you have already started tapering down because of the knee pain. So it shouldn't be too hard to increase your cross-training. But in particular, most runners are really linear and they only run forward. So mix it up. Do some side shuffles, run backwards. I'd say if you ran for a mile when you're healthy, do a block of side shuffles, one direction, then another block the other direction, and then run backwards if it's safe to do so. This really mixes it up and decreases the likelihood that you're going to overtrain some of the muscles and put more wear and tear on certain muscles than you need to. And the trick is, we want to spread out the load throughout the whole leg so that all the hip muscles are not overtrained and some areas aren't breaking down too quickly. So it's important that you make sure that this is actually runner's knee before we start trying to treat it. So in order to do that, I'm going to run you through 3 easy things you can do at home to dig into it. So we're going to do it on ourselves. The first is to try to figure out if there's inflammation under the kneecap. There's 2 good tests for this. The first one is you create a little ledge for the top of the kneecap, and then you contract your quad as you're holding the kneecap in place. So you hold it here, you contract the quad. You can see how my kneecap kind of fights with my hand and tries to lift itself up. If that's painful, that's a sign that there's inflammation under the knee. We're going to also look at all the other different directions of the knee. So Gently kind of move it in all the different directions, see if any of those are tender or create pain. If so, you probably have some irritation under your kneecap. But to really dig in, you're going to push down as hard as you can. Imagine you have someone else who's doing this test. They'd be standing over you, kind of pushing down. It's easy for them to get a lot of leverage. It's hard for you to get good leverage, so you are going to have to use force. So in this case, you're going to push down and you're going to kind of move it all around, kind of grind it in place. You're looking to see if there's any inflammation in any of those, what should be really smooth surfaces. And you're looking to see if there's lots of friction. So again, push down hard, move it in all the different directions of the leg. If that creates pain, then you know that there's some inflammation in there. And then last but not least, you can use some tape. I'm using KT tape here today, but if you don't have any KT tape, you could use packing tape or something like that. It's only going to be on you for a couple minutes. I cut a strip of KT tape in half. You're going to tape on the outside of the leg, basically pulling as hard as you can across to the inside of the knee, which is trying to really move the kneecap more towards the inside of the leg. I like to use 2 strips if it's KT tape to kind of get a little bit more of a pull. So as hard as you can pull it, kind of anchor it with your hand on the other side to the inside of the leg. You'll see how that kind of creates some bunching over here as it's pulling that way. And then the concept is you go out and you do the stairs. If you have hairy legs, you can shave it down. It'll make the tape last a little longer, but if you're just going for a couple minutes, it should hold in place. But you're gonna go do the stairs, go back up, go down, see if it feels better. In this case, if it feels better, that's a good sign that there's some imbalance in the muscles around the knee, and we're gonna dig into that